Hello, this is Dr. Do again. This video is on alphabetic list problems on letter L. Last time I talked about the very common condition, myocardial infarction. Today I'm going to talk about another condition, actually a group of conditions associated with this letter M, mental integrity. I did not call it mental illness or mental diseases. I'm saying it mental integrity. I think this which includes a wider variety in addition to the diseases and also some mental status and how to maintain a mental health in an optimal condition. So that I call it mental integrity. So first of all, let's bring out the emergency. Are there any conditions associated with mental conditions warranting emergency visit? Yes, the first one is there's a very common, serious condition called the mental status altered mental status, which lost consciousness or delirium and with the thought of dangers to either to self or to the others, or just lost consciousness, lost the mental status. So these are all the emergency situation. Need to really seek medical attention as soon as possible, either the profession, the specialties, or the emergency room to get evaluated and get treated to protect not only the patient and sometimes the others. So this is about the mental conditions warranting emergency visit. Any mental status, mental conditions you can manage at home. Actually, we're probably dealing with it every day. The stress, the mood of fluctuating, not quite happy. We cannot be happy all the time. So those are the conditions associated with this mental integrity. And we do it, use different method, either from medication, from the over-the-counter medication to physically relieve the pain or the soreness or the tender, and also the prescription medication to help us to battle this, keep our body function at the integrity, the whole organism function at the optimal level. So talk about this. Let me just finish this emergency signs associated with this mental integrity, and also some conditions that we manage at a daily basis with or without medical prescription, prescribed medications or otherwise from medical professionals. Let me just talk about the mental integrity, how to maintain this mental integrity, including objective physical illness, which had great impact in our mental integrity, or some subjective, just the feelings, not objectively seen or tested, but this is just objective feelings or emotions, or through what we see, through what we hear, through the different angles of the view, which has a great impact in our mental integrity. So these are, I think, I call it non-objective, subjective causes of this mental, which disturb the mental integrity. So the physical, first talk about the objective diseases. First of all, the physical diseases like diabetes, hypertension, or pain, chronic pain, or any lung disease, or cancer, any of those physiological diseases, or the real illness from mental illness like schizophrenia, depression, anxiety, etc. So these are the objective causes affect the mental integrity. So of course this whole group of diseases has to be managed by the physicians. For example, hypertension managed by the medication, or diabetes managed medication, the chronic pain either through the severe different scale of severity and managed with different strength of medications. Of course, this is, and also the mental illness, schizophrenia, or depression, anxiety, which are all managed by the physician, psychiatrist. So these are the objective causes which had a great impact on the mental integrity. The subjective, this is a kind of very subtle but very real, and we all have to deal with it every day. In addition to the objective physically fatigue or tiredness and stress, either lack of sleeping or work hard, and deal with daily life and activity and career and learning, academic. So these are the inside of this subjective view, and really have the objective associated with this, and then how to view it, how to see it, how to sense it, how to sense those objective, real, and interpret it in the subjective way. So this is the really very important, actually plays quite important role in the mental integrity. For example, I think a very typical example is cancer patient. They're different, there's no study for this. In the Oriental culture, for the patient who were diagnosed of cancer, the family will hide this truth from the patient, and until the last minute, and the patient realize it. There's a good part with it. So the patient did not know it's in the end stage. We keep optim and motivate the patient to keep battling this illness. On the other hand, the negative part associated with this kind of hiding information from patient is at the last minute, the patient will have probably a lot of regrets that probably in short time after the patient know there's no chance to be happy, just because there's so many sadness left behind this. So these are the example. There's no study in terms of whether the patient should be, I couldn't find the information, which one is better, but it depends on the view, the point, the subjective thought. I think this should be individualized. From my opinion, probably this should be included in the view of care. Ask the patient, if you're diagnosed of the end stage of disease, do you want to know or not? If you want to know, then the physician keep the record, so I'll tell you when the diagnosis is found. Or the other group patients, I do not want to know, then you just make a note. I do not. The patient will waive the right to know the end stage illness diagnosis, such as cancer. So this is about, and talk about this, talk about the view. I think different people has a different way to release the stress, or to coping with this daily objective or factors to affect the mental integrity. So find your own way. The point of this is the mental integrity really is very important. Sometimes it's on top of the physiological diseases. So keep it in a way to maintain the optimal function level, to maintain the health, general physiological health under this mental integrity. So this video kind of not a specific mention an individual disease, just general point of view of how to maintain the mental integrity. I hope it helps, and probably you already know it, but just if you know it, and I just hope you'll continue to dig deeper to maintain how to maintain the mental integrity for everybody, for yourself, for all the people around you. So I'm going to stop here today, and thank you for watching. I will see you next time.